I'm just going to pause that for a second. So I'm just going to put you all on mute as well while I'm talking, just so there's no interruptions. It's not going back and forth. So if you've got any questions, you can either use the chat box at the side, and I will try and ask while I'm presenting and try and answer while I'm presenting, or you can save them for the end. So I'll leave time at the end if for anyone who's got any questions. So I will go again. I'll share my screen. Okay. Okay, and just give me a thumbs up again if it's going to the next slide. Okay, great. All right, well, I'll get started. So I'm going to be talking to you today about exercise after cancer and going through some very recent research on exercise after cancer, as well as exercise recommendations on what we should be doing and going into a few more specifics with that. So to start with, I know most of you here, but for anyone who doesn't know me, I'm Beth. I run exercise classes for people who are living with long-term health conditions, including cancer and neurological disorders. As part of the support I provide, I do group classes as well as an online program. I provide one-to-one support, and I've got a free exercise guidebook on our website. And these are broken down into exercise for cancer, Parkinson's, MS, yeah, so if anyone's interested in and hasn't downloaded one of those, there's some information that you might find helpful on there as well, but I'll be going through quite a lot of it in today's presentation too. So as part of the program as well, as part of our online classes, we've got exercise recordings, which are split into different sections. So we've got exercise to target your symptoms, shorter length classes and resources, which is where I'll be uploading this too. So for anyone who's watching in the members library, this is where you'll find that there. And for anyone who wants to go and rewatch as well, you're welcome to visit there. Okay, so in today's workshop, I'm going to be talking about the benefits of exercise. I'm going to be going through resistance training, cardiovascular exercise, mobility and flexibility, balance training, how to structure your exercise, how much rest is necessary, learning how to adapt your training while managing energy levels and symptom fluctuations, how to progress your training, and then a little bit more on finding exercise support. Okay. So to start off with, I'm going to go through some very recent research, which has been really interesting and quite groundbreaking, really, and as it's something we already knew about, but this is really research that is confirming and validating the work we do. So this was a study it was called the Challenge Trial, and it was published in the New England Journal of Medicine. And there's been a lot of research before on how exercise can help you manage treatment-related side effects such as fatigue, muscle weakness, just improving quality of life. And there's been observational studies that's looked at how exercise can potentially delay the risk of the disease progressing or help prevent recurrence. But this was the first real study that looked at exercise in the same way it looks at drugs. So it was a phase 3 trial. And the way it worked is that it was studying people with high risk stage 2 or stage 3 colon cancer that had been treated for surgery and chemotherapy. There were 445 who participated in a 3-year structured exercise program, which was the equivalent of around 45 to 60 minutes of brisk walking or 25 to 30 minutes of jogging. And participants in the exercise group had a choice on the type of exercise that they could do, but they were guided with a personal trainer to help ensure that they were meeting those guidelines. So it was a very strict kind of regimented exercise group. And these were compared with a control group of a similar number who received health education materials promoting physical activity and healthy eating. So the first group was exercise and prescribed exercise. The second group was just the information. And the results here were that recurrence. So after 5 years, the exercise group had a 28% lower risk of colon cancer recurrence or developing new cancers. So this was 80% who were disease-free versus 74%. And then survival at 8 years, exercise participants experienced a 37% reduction in risk of death. So that was 90% versus 83%. So this is really huge findings. And this is something that Julie Grallo, who is the Chief Medical Officer of ASCO. So she wasn't involved in the study, but this is something she said. She said, it's the same magnitude of benefit of many drugs that get approved for this kind of magnitude of benefit. 28% decreased risk of occurrence and 37% decreased risk of death. And drugs get approved for less than that, and they're expensive and they're toxic. They come with all kinds of side effects, as we know. So this is really, really huge findings. And it shows us that exercise not only is to improve our quality of life and to make us feel better, but it can also help us live longer as well. So really interesting stuff. And I'll just share a few implications from this and then a few recommendations based on this research. So it is the first high quality trial to confirm exercise as a true treatment beyond quality of life for people with colon cancer. And experts and major bodies strongly recommend integrating structured exercise coaching into post-care treatment. And even though this study was done on colon cancer patients, evidence hints that similar benefits may apply to survivors of other cancers. And I'm sure there's going to be more research going on into this as well. And then some recommendations based on this. So our weekly goals of physical activity should be 150 minutes of moderate intensity aerobic activity plus 2 strength sessions a week. And these are the NHS guidelines. We have known this already, but this study was working towards a similar amount. If you're doing higher intensity aerobic activity, it can cut down to 75 minutes rather than 150 minutes. But it's complete, that's the choice up to you. So some people prefer to do it as moderate intensity. They find it more manageable. Some people prefer to get it over quicker. I recommend choosing sustainable activities. So the key with exercise is consistency. There's no point doing loads one week and then nothing at all the next week. It's about finding something that you can enjoy because then you're more likely to stick to it. And that's when you're going to feel the benefits and experience the benefits. Stay motivated. So this study, these people were all working with a trainer or a coach who provided, or a physio who provided exercise guidance on what they were doing. So this study does suggest that we should create accountability, whether that's through one-to-one support, group sessions. So there are loads and loads of group classes in person as well as online out there for people with cancer. Or just finding friends to exercise with, because that can help with adherence to exercise. It can help with motivation. It can keep you accountable. But don't forget to get medical clearance as well, especially important post-treatment, to make sure you're able to tailor your exercise to suit your needs as well. So a few recommendations based on this research. I'm going to go into a few more studies as well in this talk, but this is the most recent one that's just come out. So I wanted to share this really interesting information with you all. So just going into a few more benefits of exercise. So in exercise in terms of managing symptoms, so there's loads and loads of research that's out there already on this, but we know that exercise can help improve muscular strength. It can help you prepare for treatment. It can help manage treatment-related side effects, including fatigue, lymphedema, osteoporosis, and muscle wasting. It can help you improve mobility and flexibility. It can help improve balance, improve bowel and bladder function. It can help you maintain a healthy weight, reduces the impact of pain, reduces the chance of acquiring other comorbidities such as heart problems. It can help reduce anxiety and stress. It can help improve bone mineral density and can improve sleep. So many, many other benefits, as well as in potentially reducing the risk of the disease progressing or recurrence. So then just breaking this down, going into some of the exercise recommendations. So cardiovascular exercise, which was what this study was based on. So moderate intensity cardiovascular exercise includes brisk walking, cycling, swimming, or dancing, anything that gets the heart rate up, gets the blood pumping, and something that might make you feel a little bit more breathless, make you feel a little bit warmer while you're doing it. And why is it important? It can help improve heart and lung health. It can enhance immune function, help you maintain a healthy weight by managing by regulating the metabolism. and it can help improve mental health as well through the release of endorphins, which can improve mood, reduce stress, and alleviate symptoms of depression and anxiety. So we want to be incorporating at least 150 minutes of moderate intensity cardiovascular exercise. So that's your brisk walking, cycling, swimming, anything that keeps the heart rate up and keeps it maintained for that consistent period of time. Or 75 minutes of high intensity cardiovascular exercise. And I'm going to go into some of the benefits of this high intensity work next. There are some benefits, but there are also some things to be aware of when you're working at a higher intensity. So high intensity training, high intensity interval training, this involves working hard for short periods or shorter bursts, followed by another short burst of recovery. So for example, it might be you're sitting on a bike or a cross trainer, something at the gym, or even outside doing a hill. So for example, walking up a hill, working hard for 40 seconds, followed by 60 seconds of recovery where you're walking back down the hill or on the bike, working hard, pedaling as fast as you can for 60 seconds, followed by 40 seconds of lowering the intensity, pedaling slowly. So there is research that does suggest that high intensity interval training can delay or prevent the risk of cancer progressing. And I'm going to go into this piece of research next. But there has obviously been more recent research that has suggested that moderate intensity cardiovascular exercise can also help reduce that risk in colon cancer patients. It is a quick and efficient way of training, so that's why the recommendations are only 75 minutes of cardiovascular exercise if you're working at that higher intensity. It's good for fat loss and caloric burn, and that's due to excess post-exercise oxygen consumption. So that's the afterburn effect, where the body's still working hard to make those repairs happen in the body. Whereas with moderate intensity cardiovascular exercise, you're not getting the benefits quite so much once you've stopped exercising. It's good for building anaerobic capacity and power as well as aerobic endurance, whereas moderate intensity exercise is more beneficial for just aerobic endurance. However, there are some things to consider. So there is a higher increased risk of injury due to a high stress on joints and muscles. If you are working harder for shorter periods, it's going to put more stress on the joints and muscles. Doing too many HIIT sessions can have a negative impact as well by causing too much stress on the body. It can lead to a longer recovery time, so you do generally need to leave a little bit longer before you exercise after a HIIT session because muscles can be left feeling sore. There's those processes that are going on in the body to repair the muscle fibers that have been worked will take a little bit longer. It increases systemic fatigue. So with exercise as well, I've talked about this when I've done a workshop previously on managing fatigue. We can fatigue our muscles peripherally, which means, so an example of peripherally fatiguing our muscles would be through a bicep curl. And that means that we're just fatiguing the muscle we're working, such as the bicep. Whereas when we're doing a full body exercise or working hard for a longer period, it results in the whole body fatiguing, which can actually contribute to fatigue. So if fatigue is something you struggle with, then HIIT training might not necessarily be the thing for you. If you're deconditioned, it can put undue stress on the heart. So if you are new to exercising or aren't doing much at the moment, it might not be the first thing that you get into, but maybe something to think about later on. No, not everybody likes it. So some people can feel unwell after doing more intense exercise. It can cause dizziness and fatigue as well, going back to the systemic fatigue. And if you're not enjoying it as well, it's going to be harder to stick to as the workouts are intense. So there are a few things to consider with this form of cardiovascular training. There are pros and cons to it, but I'll just go on to this study. So this was again quite a recent study. I don't actually think I've got the date on this one, but this was a study done by Tel Aviv University, and they found that exercise can defeat cancer by increasing glucose consumption. So the study combined a 20-year human study. So there were 3,000 volunteers with a detailed lab experiment using mice. So they found that participants engaging in high intensity aerobic exercise, such as running or cycling, experienced a 72% reduction in metastatic cancer incidence in comparison to sedentary peers. And then in the mouse study, they found similar results, and they found that aerobic activity significantly reduced the development of metastatic tumors in the lymph nodes, lungs, and liver of the mice. And they hypothesized that this outcome is related to the enhanced rate of glucose consumption induced by exercise. So we know that cancer cells can thrive off glucose. If the demand for glucose is in other cells in the body, that can potentially reduce that risk of that cancer thriving and growing as well. So that's the theory behind this. So this was a study that looked at HIIT, so high intensity aerobic exercise. This was a slightly older study. So we've now got that more recent study finding similar findings to this as well with moderate intensity exercise. So pros and cons for both. If you're not sure, recommend asking a personal trainer or a physio about whether it's suitable for you. And then going on to resistance training. So recommendations for resistance exercise is that we should be doing at least 2 strength sessions per week. And there are many, many benefits to resistance training. And this is so, so important as we get older as well. So I'll go through a few of the benefits. Well, first of all, what this counts as. So resistance exercise involves, it could be weightlifting. It could be body weight exercises such as push-ups, squats, lunges. It could be work using resistance bands that you can do at home, or it can be using weight machines at the gym. You can get the benefits from any form of strength training. It's about preference, it's about working out what works for you and following the correct principles as well while you're doing it. So I'll go on to this a little bit more, but firstly, why is it important? It can improve muscle strength, and cancer and its treatments, such as chemotherapy and hormone therapy, can lead to muscle loss. So strength training can counteract that impact. And the way that this works is that when you're strength training, when you're targeting the muscles, you're essentially damaging the muscle fibers. And as they repair, they're going to grow back stronger, which results in improved muscle strength. It can also help reduce fatigue. So regular resistance training has been shown to boost energy levels and improve overall endurance. And it can improve bone health. So some cancer treatments like hormone therapy or chemotherapy can weaken the bones and increase the risk of osteoporosis. As we get older as well, our bone mineral density can decline, but resistance training can stimulate bone growth and reduce the risk of fractures. So another really, really important benefit of strength training. And the way this works as well is that when we're doing resistance training, the muscles are putting stress on the bones. And that, so again, that stress on the bone can stimulate the production of osteoblasts, which can help grow the bones. So similar way to how strength training is through damaging the muscle fibers, that's how they grow back stronger. The way we improve bone mineral density is by putting stress on the bones, forcing them to repair, create those osteoblasts, and results in stronger bones. So the 2 main types of exercise that we want to make sure we're incorporating into our weekly routine. Just share this study as well, because I don't want to leave resistance training out. But another systematic review in breast cancer survivors found strong associations between muscle strengthening exercise and reduced recurrence on mortality. And the OptiTrain trial, again on breast cancer, found that combined high-intensity interval training and resistance training lowered the risk of death and reduced invasive recurrence compared to usual care. So again, there is research that does suggest that resistance training, as well as cardiovascular or aerobic exercise, can reduce that risk of cancer progressing. So other exercise that we want to be incorporating into our routine, and this can be done alongside your cardiovascular exercise or your strength training, it doesn't need to be done alone, is mobility and flexibility work. So this includes yoga, Pilates, just general stretching routines that you might do at the start of an exercise or at the end of an exercise, or Tai Chi. And why is this important? It can help reduce muscle stiffness and rigidity. So it can help loosen tight muscles and reduce discomfort. It can help improve range of motion, and this is particularly important when you've had surgery or treatment that has led to a reduced range of movement. It can help prevent muscle tightness and atrophy. So treatment and inactivity can lead to muscle tightness and weakness. Mobility exercises can help prevent muscle shortening and maintain function. It can help enhance circulation and reduce swelling. So gentle mobility movements can help promote blood and lymphatic flow, reducing swelling and discomfort. And how often do we want to be doing this? Just regularly throughout the week. If you're tight in a particular area, so for example, if you've had breast cancer surgery, then it might be that you want to be doing it every day. If you don't have particular tightness in a certain area, then I recommend at least doing it 2 to 3 times per week. But as I said, you can combine this with your other forms of training. So maybe just doing a stretch after your strength work. And then balance training. So balance is again something that can be impacted as a result of treatment, whether that's surgery or chemotherapy. So it can be impacted due to peripheral neuropathy. But also again, as we get older, our balance can get worse. And balance is a complex skill. It does require a multifaceted approach. So to improve balance, it's necessary to take practice in a combination of different exercises, so strength, flexibility, balance-specific exercises, and coordination exercises. So you don't want to just be repeating the same balance exercise over and over again, because that otherwise you're going to hit a plateau. The body's not going to learn to adapt to different demands. You want to be varying your exercises, so varying the work you do to improve your balance, but also varying those balance exercises as well. So why should you vary it? The body adapts over time, so changing the exercises keeps the brain and muscles engaged and continuously improving. A variety of movements stimulate the brain and help create new neural pathways for better movement control. And varying the exercises can help mimic everyday movements, making the exercises more functional. So I often encourage people to practice when they're standing on one leg to do it on different surfaces. If you're doing it just on a solid surface all the time, that's not necessarily going to resemble a surface outside where you might commonly feel more unbalanced, such as walking along the grass. So good to practice as well on a different surface, like standing on a cushion or a rolled up towel on the floor. So balance exercises, again, we want to be practicing it around 2 to 3 times a week. If your balance is worse, if this is something that has impacted you, then this is one, again, you want to be practicing every day. The more regular, the better. It is a more challenging one. I think people often get frustrated with balance because they can see improvements a bit quicker with their strength training, with their cardiovascular exercise, whereas balance, you've got to really, really stick to it, really, really focus on it to see those improvements. But if your balance is quite good in general, then doing just your general strength and flexibility exercises could probably be enough to maintain that balance to keep improving it. And if it's worse, then focus a little bit more on those specific balance exercises and coordination work too. Okay, then just going on to structuring your exercise. So how do you want to be structuring your exercise each week and within the session? So it's important to spend a bit of time at the start of the workout to gradually bring the heart rate up and get the blood pumping before you go into any exercise. More important when you're doing your strength training, but also important if you're doing cardiovascular exercise as well. If you're going out for a walk, some people might find the first 5-10 minutes of the walk a little bit painful on the joints, and you might feel a little bit stiff. So that's why you want to start slowly, maybe beginning with a slower walk and then working up to that moderate or vigorous intensity. If you're working cold muscles with strength training, you're much more likely to get injured. And then you're also not going to have a full range of movement, which means that you're not going to get the full benefit of the exercise. So don't neglect your warm-up. Warm-ups are so, so important, such an important part of your training. I'll just give you an example. So if I woke up in the morning and my shoulder was quite stiff, I might just have a very small range of movement here while I was moving the arm. If it was nicely warmed up, if it was warm, the muscle's going to be more elastic, more fluid. I'd get a much fuller range of movement. So I wouldn't just be going from here. I'd get the arm right back here for my chest press, pushing all the way in front. Start with basic exercises, focusing on major muscle groups. If you're new to exercise as well, definitely start with more basic exercises and begin with light weights to master the form. And then gradually increase the load by either increasing the weight you're working with, increasing the number of repetitions that you're doing. You can increase the range of movement or increase the time the muscles are under tension. So an example of this would be rather than just doing a squat, it would be holding the squat for 15 seconds or 20 seconds at the end. So those muscles right at the end of the range of movement are under more tension. So there are many ways that you can progress your training, your strength training. It doesn't have to just be by upping the weights. It can be increasing the repetitions, increasing that range of movement. As long as we're working under around 50 repetitions, you can still strength training will still result in improved muscle strength and the hypertrophy as well, which is increased muscle size. If you're doing much more than 50 repetitions, you probably won't be if you're working under 90 seconds. Then the benefits won't be so great. So good to stay under that 40, 50 rep range. Another way to improve your training or advance your training is through adding variety as well. So like our balance exercises, we can reach a plateau if we stick to the same thing and just do the same thing over and over again. So it's important to introduce new exercises or variations to target different muscles. So rather than just doing a squat all the time, good to vary it to doing a different exercise like a step up or a bridge on the floor. So you're still working similar muscles, working muscles in the legs, but you're varying it, making sure the body continues to adapt. And like our warm up, our cool down is really important. So always finish with a few stretches. This is to help lengthen and realign the muscle fibers that you've been working. More important after your strength training, but still good to do after a bit of cardiovascular exercise as well, and particularly if you're working at a more vigorous intensity. And you want to be holding each stretch for around 15 to 30 seconds. And listen to your body. So muscle soreness after a workout is normal, but if you do experience pain, stop and consult a professional. So I always say soreness in the muscles is normal. Soreness in the joint is something to be more concerned about. So that's maybe when you want to monitor it and just make sure it doesn't stay. And then allowing adequate rest and recovery. So rest is just as important as our exercise. It's important to leave at least 24 hours in between strength training. So if you're doing strength training on Monday, you don't want to be doing strength training on Tuesday, or at least you don't want to be working the same muscles. If you're doing lower body on Monday, you can do upper body on Tuesday, but you do want to leave at least one day in between. And the reasons for this are muscle repair and growth. So exercise creates microscopic tears in muscle fibers, and this is how they do learn to repair and grow stronger. But rest is important for allowing that repair. If you're working back to back, doing your sessions back to back, not allowing enough recovery time, it's not going to result in progression, which is why it's important to leave that time. Overtraining without sufficient rest increases the risk of injury. So proper recovery reduces the strain on the muscles, joints, and tendons. It can result in more efficient exercise and more progress. So fatigue from lack of rest leads to reduced strength, endurance, and coordination. So leaving enough recovery can help you achieve more consistent progress. And then there's also mental health benefits. So if you're training back to back, if you're not allowing your body enough time to recover in between sessions, then it's probably going to lead to burnout, where you lose motivation, you're less likely to continue with the exercise. So mental health benefits as well in reducing stress and preventing burnout. And then how much rest as well to leave. I think I said that before. So at least one day, but with your rest, it doesn't need to be complete rest. So I don't mean just sitting with your legs up all day. Active recovery counts. So you can do your cardiovascular exercise, gentle or moderate intensity cardiovascular exercise. You just don't want to be working vigorously on those days after. Yoga or stretch work as well is also fine in the day after. Adapting your training while managing energy levels and symptom fluctuations. So this is more important for people who are going through treatment or maybe recently finished treatment. Exercise snacks. So I don't mean snacks of food. I mean breaking your exercise down into smaller chunks of the day, which can be more manageable. So if you are struggling with motivation or fatigue, then rather than doing one 45-minute, one 30 to 60-minute exercise session at once, then break your exercise down, do 5 minutes in the morning, 5 minutes at lunchtime, 5 minutes in the evening. Gradually try and increase that time. So you're doing 10 minutes in the morning, 10 minutes lunch, 10 minutes if evening. And that can have similar benefits as well, whether that's for your aerobic exercise, your cardiovascular exercise, or your strength training as well. Researchers suggest that that does result in similar benefits to doing it all at once. Opt for seated classes as well. So I mentioned briefly at the start that peripheral fatigue in the muscles and that systemic fatigue in the whole body. If you're doing something seated, that's going to conserve your energy kind of in the main part of the body. And so you're still getting benefits of exercise, and particularly if you're doing your strength training, but it's going to result in that peripheral fatigue in the limbs or in the muscles that you're working rather than fatiguing the whole body. Change the range of motion of exercises. So if you are feeling like you're struggling with fatigue, you're struggling with your energy levels, then rather than doing a full bicep curl, just focus on that very end range of the movement to make it a little bit more manageable. Also use lighter weights or lighter resistance as well during this time. If you're struggling with fatigue, it might not necessarily be the time that you're working towards progression or huge improvements in your strength through your fitness. It's more about just maintaining some level of activity. So don't be afraid to drop your weights down to help you maintain that consistency as well, which I mentioned is really, really important with exercise. And this, in our members library, for those of you that are members, you can, if you are struggling with fatigue, you can visit our shorter length class section. We've got loads of 5 to 20 minute classes, which I say are perfect on the days that you're low in energy or just struggling to find the time to fit one of the full length classes in. So maybe you're on holiday, maybe you've just got a busy week, but these ones are good to opt for. Progressing your exercise. So the opposite, maybe you're quite a way through treatment and you're thinking about how you can progress your training. So a few options, and this is more relevant for strength training, but increasing the weights. So gradually adding more resistance to your exercise. You want to aim for small increments, and once you can comfortably complete your target repetitions with good form, you could think about increasing the weights that you're working with. And these are different options as well. So there are different ways of progressing your exercise. You don't have to increase the weight to result in progression. Another way is through increasing the range of movement. So working to a full range of movement to engage more muscle fibers, such as in squats, go deeper while maintaining proper technique. So you might have found that to start with, you were just going for a very small bend of the knees before your muscles hit that point of fatigue or muscle failure. As you progress, you're going to find you're able to go deeper into your squats. Increase the number of repetitions or sets. So if you're not ready to increase the weight or you don't use weights, maybe you just use your body weight or resistance bands, then have a go adding more repetitions. So moving from 8 to 12 repetitions or adding additional sets. So rather than doing 2 rounds or 2 sets of the exercise, you could do additional sets to increase the volume and endurance. You can slow down the tempo or add holds or pulses. So this is a good way that I like to use quite often in our sessions because everyone can work at their own level. So particularly in our group classes, and for when people maybe don't have as much equipment at home, you can control the movement by adding an increased time under tension. So for example, lowering into squats for 4 seconds rather than going down quickly. And it can increase the time that the muscles are working for. And reduce rest time in between sets. So shortening rest periods forces your muscles to work harder with less recovery time, improving endurance and increasing metabolic stress while still promoting strength gains. So there are many ways that we can progress our exercise. It's about finding what works for you. But ultimately, with strength training, you want to be pushing the muscles to that point of failure. So at the end of each exercise or each workout, you want to feel like your muscles aren't able to do many more repetitions. And that's a sign that you've hit that point of muscle failure or fatigue or muscle overload. And then lastly, some websites that you might find useful for more exercise support. But I'm just going to talk about 5K Your Way briefly. So 5K Your Way is the bottom left picture. This is part of Move Charity. So Move Charity is a young person's cancer charity. We work with 13, so I'm a freelance trainer for Move, which is why I say we. But we work with 13 to 30-year-olds who have been diagnosed with cancer. And then 5K Your Way is kind of a branch of that. It involves meeting at a local park run on the last Saturday of every month to participate in park run in some form or another. So that can be walking it can be walking half the distance. Quite often, park runs are done in loops. So you do often have the option to just do one loop rather than multiple loops. It can be just by turning up to volunteer or cheer your fellow 5K Awayers on. But it's a cancer support group with a difference, and it's to encourage people to get out, get moving, support one another with exercise. I am an ambassador for this in our local Rickmansworth one. Our group has been on hold for the last year, but we're actually relaunching in July. So for anyone who is local, it will be brilliant to see you at our local 5K Your Way group. So the first one, I think it's the 30th of July. But if anyone's interested, let me know, because hopefully we're going to get a good turnout for that. We've got a new team of ambassadors, but just a brilliant thing to get involved in. And they're all over the country as well. So if you're not local, if you're an online member, then you will be able to find one near to you too. And then there's Maggie's. So Maggie's, I run a group exercise class for Maggie's Oxford. A lot of the Maggie centres do exercise classes either online or in person. Macmillan and the Cancer Care Map, if you're wondering where the nearest exercise class is to you, if you want to do more in-person stuff, you can find support on there. And then on the right, this is just a picture of the online program. I know quite a few of you are members of this anyway. But with the online program, we do 5 online sessions a week. All of the classes are recorded. They're focused on improving strength, mobility, cardiovascular fitness, and balance. And then in our online section, we've got classes to address specific disease symptoms and treatment-related side effects, such as shorter length classes to help you manage fatigue, classes specifically to help you manage your balance. We've got unilateral exercise classes, which helps you focus on one side of the body at a time. There are multiple benefits for this. But if you find you've got a very dominant side and a weaker side, maybe as a result of treatment, or you're just right-handed and you're right-handed dominant, then these type of classes can be really beneficial. So there we go. If anyone has got any questions, I've left 5 minutes here at the end for you to ask any questions that you've got now. Or you're very welcome to get in touch, drop me a message. But hopefully you found this interesting, and hopefully you found the new research that's recently come out very compelling and very motivating to get you either moving if you're not already, or maybe upping the work you're doing slightly. All right, so let me know if anyone's got any questions. If you don't,